All right. Good afternoon, everyone. Welcome to the February 26th. I'm going to look at the clock, the date, Health and Safety Committee meeting. I am joined today by my colleagues and staff and would like to welcome you. I'm going to let them introduce themselves and then we'll call the meeting to order. To my left, that would be you, board member.
I'll go ahead and. I am Vice President Mary Weinberg, and I am part of this committee, and I look forward to a very robust conversation about health and safety. And to my left.
All right, good afternoon. I'm Dr. Derek Little, and I serve as Chief of Staff.
Great. Well, thank you so much. We have a whole full audience today. Welcome to those who have joined us, both online and in person. We do have quite a bit to get through today, and we're going to just jump right in. I think most of this is a presentation from Dr. Little. Is that correct?
That's as I understand it as well.
Okay. Well, then, as I pull this up, let's go on ahead and get started.
Dr. Moffitt, I did just want to clarify, the order of the presentation is slightly different than the order of the agenda. Would you like to go in the order of the slides or what's on the agenda?
How out of order is your presentation? Is
It's
it just like
pretty out of
1,
order.
3, 4?
Yeah.
It doesn't matter. We'll get through it. We're gonna have a very comfortable meeting today. I think it's been pretty good order, but let's just start however you'd like to start it.
All right. We can go to the next one, Rob. So we'll start with discipline and the code of conduct. Some data to share here based on where we were in the fall semester, beginning with a review of what the top 10 offenses were for fall 23. So this ranks them. So disruptive behavior as a category 1 offense. We had 1,617 of those offenses in the fall, all the way down to tobacco and smoking, which is a category 2 at 150. There are obviously other offenses that are possible in the code of conduct, but this just shows you the top 10. I think a few takeaways here. 4 of these are category 1, which are things that are generally dealt with and managed within the classroom by the teacher. 5 are category 2. That's when things start to escalate into office referrals and potentially can have exclusionary consequences associated with them. These are offenses, not students. So if a student had multiple offenses on this list, that's counted at the offense level, not at the student level. And that just sort of shows you what we're trending across the district in terms of what's showing up the most. Next slide, slide 4, looks specifically at what discipline is between racial groups. So we've talked about within the goals and guardrails, a lot about discipline disparities. Those 2 slides that the superintendent recently presented to the board are in the appendix here in case we want to reference them. But the larger chart here looks at each category separately, so 1, 2, and 3, and it compares based on the students of color who have been disciplined versus white students. So what we see year over year, if we compare last year, 22-23, to this year in the fall 23-24, we see decreases in every category, which is good. That means our disproportionality is going down, which is certainly what we want to achieve. The 3 smaller charts dive deeper into those categories where you can see the rate of white students who had a disciplinary offense versus students of color. Category 1 is a little bit different, and I want to call that out. Even though the equity gap got smaller, it got smaller with both student groups having higher rates of discipline. So there was more discipline of white students in category 1 and more discipline of students in color. The white student rate increased faster, which is why that gap went down. So as we were talking about this even last week with assistant principals, that's not the pathway we want to take to reducing the equity gap. That's part of why we wanted to double click and look in the data in more detail. But we see for category 2 and 3, the opposites occurring where we actually have a reduction or relatively flat level of discipline rates for our students of color. I did try to be responsive to a request from the board, so total population numbers are shown here on the slide as well. The next one looks at two different things. So on the left, we're looking at students referred to the Promise Center. On the right, we're looking at students based on whether they have an IEP. When we look at the Promise Center data, we notice that year over year, this is a measure of August, including January, so a little bit more than the fall. We see declines across all student groups and students being assigned to the Promise Center, which is again, really good. We want to limit the number of exclusionary consequences as much as possible. When we look at our students with special needs, we see that students who don't have an IEP had a slight decrease year over year, but students who do have an IEP basically remain flat. I would remind the public in the board here that for a student on an IEP that is being recommended for an exclusionary consequence, particularly if they're going to the Promise Center, there is a separate process that has to be gone through before that student can be disciplined with an exclusionary process. It's called a manifestation of determination review, an MDR. So a committee has to come together. They have to understand if that behavior is associated with their discipline or not, and then a disciplinary decision can be issued. And then last one here on discipline data on the next slide is a first look at our schools that are going through the restorative practices work. So as a reminder, we had 17 schools this year, which includes all of our Title I high schools that have started to be trained in restorative practices. This breaks down year-over-year comparisons, fall to fall, by category. And what we see is declines year over year in Category 1 and Category 2. So we're starting to see some early sign of impact here. We see a slight increase in Category 3, but we've intentionally plotted all three of these graphs side by side on the same axis to also show that Category 3 is a much smaller portion of discipline compared to Category 1 and 2. So as more and more folks get trained and as this starts to get more cemented, we would expect to see that decline in Category 3 as well, but are quite pleased with the early signs here in the lower level of disciplinary offenses.
I want to stop you very quickly and kind of entertain some questions that I know I have. For the public, can you outline what a Category 3 offense would be?
Yeah, and it might be helpful, Rob, to actually pull up the code of conduct. If you go back to slide 3, linked in the bottom there is the code of conduct. So Category 3 are the most severe offenses with the code of conduct. Those are things that include assault, if there's assaulting involved. It includes weapons. Rob will go to page, get to the right one here, 18. So these are generally things that potentially have a violent behavior associated with them or just outright illegal behavior associated with them. So depending upon the age of the student, there could be criminal implications here. So what's on the screen now is the start of the pages of Category 3 in the Code of Conduct. So you see hazing, alcohol and drugs, physical assault, bodily injury. That goes on to other pages as well. Category 3 offenses can result in recommendations for either suspension or expulsion.
And I'm going to ask another question a little bit later regarding alcohol and drugs, but I think you said tobacco was Category 2. Okay, so Category 2 and 3 are where I'm going to ask a little bit of more questions a little bit later, but definitely continue. Thank you so much.
Yeah, and another question for the chair. What had been our practice in the last year is to sort of take these section by section and then entertain questions. Would you like to do that, or would you like me to continue on into the other topics?
Go ahead.
I was actually going to ask if I could ask a question before moving on to the next topic, because I know that I will forget.
That was going to be my point, is that I think I want to entertain at least one or two during the time, because I don't want us to kind of flip flop back and forth. And I know that we do, that some of the committee members do have questions, but go ahead.
Yeah, thank you. So my question is regarding the different categories. So you have Category 1, 2, and 3. And in terms of Category 3, referencing alcohol and drugs, I just wanted to know the numbers that you gave in terms of discipline reports. How many of the offenses are due to drug interactions or medical emergencies due to substance abuse? Do you happen to have that information or can provide that data or the numbers for that?
Board Member Weinberg, we can answer how many are associated, like how many are labeled as an alcohol or drug offense.
Yes.
We would not necessarily know whether that's related to substance abuse or not, because a student could have something on their possession, in their locker, in their bag, but that may or may not indicate actual use of the substance.
So if a student has this substance in their bag, what category would that be for them if they're caught with it?
It would still be alcohol or drugs.
Okay. And if a student takes a substance and has a reaction, what is it logged in as when this incident occurs at a school?
If we know that that occurred, it likely is also an alcohol or drug offense. Obviously, medical treatment is provided to that student by the nurse, by EMS, or calling 911 if there's an obvious need for medical intervention. But from the disciplinary perspective, if it's known that they took a foreign substance, that would also in most cases go back to alcohol or drugs.
And so just to make sure I heard, we do not have the data on that, or are you saying you don't have that? Or can you get it?
We can tell you how many are alcohol or drug-related offenses, and I'm looking. That was obviously not a top 10, thankfully, so it wasn't in the
Great.
chart, but I can tell you. There were, in the fall of this school year, there were 27 that were like drug paraphernalia related. And I need to look one more place.
And the number
Actually, that's
27 that you just stated, can you repeat that? You said 27
Yeah,
for?
27 with drug paraphernalia. 4 that were related to potentially distribution of drugs.
Going back to the 27, is that this, I didn't hear the year. What you?
Fall.
Okay,
Fall of this year.
so fall of
And-
this year.
And the data I'm looking at, by the way, is taken from the goal and guardrail slides, which are in the appendix. So linked in there is all of the data and including the list of offenses by type. So that's
And-
where I pulled those numbers.
And where would that link be?
It is, Rob, are you able to drive again? Can you go to slide 25?
Yeah, I know I was having a little bit of some difficulties clicking onto the links before.
We got that fixed today. That was my
Great.
error and my apologies. Rob, in the footnote at the bottom, all discipline actions here, the second here in that third line. Yep.
Okay, I think I see.
And then you're
here
gonna
as
have to
well.
scroll quite a ways to like row 700.
And this data should also be available
There.
publicly as
You
well.
just passed it, Rob. That little 2-column list are all of the offenses from the fall.
Ooh, I think I clicked on the wrong one. So where
No,
am
you
I?
just gotta keep scrolling.
Down?
Do you have this data as a trend from year to year, but not just?
Perfect.
Again, in my mind, I like trend data. I don't like just, hey, this is a snapshot, because it really doesn't tell from a data perspective, the entire story. So we know that in the city and across the country, vaping is up, and which may or may not be tobacco, but that there are concerns around other districts around substance abuse. And board members do get some information regularly. So I am interested in trend data. Is this seen as a decrease from this time last year, this time 2 years previously? But it should also match what's going on nationwide as well. So I'm looking forward to hopefully being able to see some comparisons from year to year to see if this is getting better. Does this mirror what we're seeing across the nation with our counterpart districts who also report very similar data as well?
Yeah, the only thing I would say in response to that right now, Dr. Muffet and Vice President Weinberg, is part of it not being on the top 10 list is really indicative. So, I mean, you got to get down to 150 incidents across the entire district, because this is not just secondary students. Those offenses are all students that are part of that top 10 list. And so drugs and alcohol are not on there, and the numbers I just gave were less than 30. So this is not like epidemic level sort of issue that we're seeing, but it is something that we obviously want to continue to be really diligent about because that can lead to much bigger issues for students and families.
Absolutely, absolutely. But it also could lend itself to how it's being reported, which could potentially be a disparate,
Mhm.
disparate, in reporting. So if it's being reported if you don't know that they took it, it may be considered a category 2, not a category 3. So I just would like for us to have some consistent data. I'm looking forward to getting it. But continue, where did you leave off?
Ready for the the anti-bullying update if we want to change topics.
Questions?
I do not. Thank you so much for answering that particular
Yeah.
question.
I do want to add one thing. Rob, we had gotten an email that board member Matt may join us virtually. I didn't see her on. Is she on? Okay, if she does come in, I want to make sure that she's able to get any questions that she has answered, answered as well. So.
Spoke her into
Okay,
existence.
board member Map, if you have any, okay. Gotcha. So we'll continue and acknowledge her when she comes in.
All right, Rob, if we can go to the next slide. So a couple of background pieces here, and then we'll look at a little data related to bullying and our anti-bullying efforts. So first is just a quick reminder on what bullying is. We find often that people use the B word here and aren't actually applying the appropriate definition to it. So this is important that we sort of level set with schools. We work to level set with families as well. As you see on the slide, there's 3 keywords to start this off: repetitive, intentional, and harmful. So an isolated event does not rise to bullying. But the other key thing is at the end of this definition, the person that has a hard time defending themselves. So there's an implied power balance that has to exist when we think about bullying. We also just did a reminder session on this with APs last week that went really well. And we also are very fortunate to have a social worker in the district who's really just solely focused on anti-bullying efforts. Next slide just reminds us all that we do have the bully button. I was in a community meeting recently reminding folks that this exists, and it doesn't matter who you are, it is accessible to you. So if you suspect bullying in one of our schools or with some of our students, anyone in the public can submit a report of bullying, and that will be taken seriously and it will be investigated. Next slide shows us that we are seeing really positive trends when we look at bullying incidents in the district. So we'll start with the bar charts on the left. These are total reports of bullying. The dark color, the dark blue, are cases that were not confirmed. So after investigation, this was deemed to not be an incident of bullying. That doesn't mean that there weren't other potential consequences or bad behavior at play, but it didn't rise to the level of bullying. That lighter shade of blue were the confirmed cases. So this goes all the way back to 2017-18. It might be the only time today, members, that I get to actually give you a lot of trend data. But we can see that the overall trend here is going down. I would remind everybody that 1920 and 2021 were anomalies due to the pandemic. So the really small numbers in 2021 are not indicative of like bullying just disappearing from Cincinnati Public Schools, but students were at home. So there were much less instances to do that in-site or on-site and in person. The line graph on the left specifically looks at the percent of cases that were confirmed. So we're graphing that light blue portion of the total. And we're certainly down into the low teens. So over this period, we've not only seen confirmed cases go down, but we're seeing total suspected bullying go down as well. Last thing, and tried to indicate this on the chart, what we're showing for this school year is just fall only, but even if that were to double by the end of the year, we would be lower than we were last year. Next slide, I think, is another pause moment.
Any questions?
I actually have a question, but I'm going to go back to topic 1 really quick. I took a couple little notes here and I forgot. I wanted to ask if we could go to slide 5 really quick. it lists the number of students being assigned to the Promise Center. And my question would be, how many of those students who actually are assigned to the Promise Center actually go? Do we have the data on that? And then my second question would be for slide 6, the restorative practice. What particular schools are piloting or part of the cohort?
Yeah, let's actually start with slide 6, Rob. If you'll open the here link there, we're showing all of the schools based on their cohort. So this year we started with 17, prioritizing Title I high schools plus elementary schools that typically we're seeing higher rates of discipline. And then category 2, sort of that middle tier, category 3, where the schools with the least amount of discipline. So over the next 3 years, we would have everybody start to engage in that restorative practices training, including capturing folks who may be new to schools at a cohort that's already gone through the initial training. So making sure there's like sustainability here. We're also in the process and really happy that we've been able to start to build our own cadre of trainers. So really making a long-term commitment to this work.
What are you hearing from the cohort 1 in terms of just feedback regarding the restorative practice?
I think 2 things in general, just actually from one of the elementary school principals in cohort 1 the other day, that school has gone even above and beyond what our desire was this year in terms of getting people trained, where they've gotten all of their 4th through 6th grade teachers trained and are knocking on our door constantly to say, hey, how do I get the rest of my school trained as soon as possible, like faster than our rollout plan? So they really believe that that's instrumental to their climate and culture work and to their PBIS work. Other schools are starting to see the behavior. Again, we've been able to share this data with some of them, starting to see the benefits rather. We've been able to share the early data with them, and they're seeing that show up sort of at their campus levels as well. So our focus is just on continuing to spread the net here as widely as we can.
Okay, thank you. And then back to the other question regarding
Promise
Promise
Center.
Center and how many students. I see that there's a number of students who are attending or assigned, but what is the actual number of attending? Sorry about that.
Yeah, we can certainly pull that data and share it with the committee. What we've seen year over year is we have more students actually showing up. So even though the percentage here of students being assigned has gone down, actual students showing up to the Promise Center has gone up. We certainly know attendance has been a struggle for some time at the Promise Center for a lot of reasons that we've heard as we've engaged with the stakeholder in the community. But we have gotten more students to actually attend in person this year.
So that was going to be part of my question as well. This is the first year, I believe, that we've ever had it to be optional that there be attendance at the Promise Center, which is a little disconcerting for me because we need to be capturing as many students as possible. If you are assigned to if you've done something where there's an offense that warrants you to be assigned out of the building, we need to make certain that we're capturing where you are. If you choose not to go, then you're considered absent, but we need to make certain. So I'm looking for the data of students, and I think it is coded. I'm not exactly sure. I remember which system it is, but of students that are assigned out of the building and students that are assigned out of the building and attending the Promise Center and are assigned out of the building and are not attending, because that is an option. So we should be able to capture how many students are choosing or families are not choosing the option to send their students. And then for me, an additional question is, of the students that are not attending, how many are getting any, if at all, supplemental services, or are they choosing not to get any services? But that data, we should know like how many students have been reported. We've got that by school. So if 100 students have been reported to be out of their buildings and only 30 of them are attending because they've been assigned to the Promise Center, but they're attending, we're capturing that attendance. So it looks great that, hey, those 30 attended, but then how are we capturing that the other 70 chose not to, because we've allotted for that in the code of conduct?
I'm not sure I totally followed all that, so I may need some clarification. To the point of attendance being optional, that I'm not sure I understand that comment, because there's certainly an expectation that you're attending the Promise Center every day, just like there's an expectation that you're attending school every day. What we added to the code of conduct was language saying that trying to add teeth to that, in fact, saying you needed to at least show up 70% of the time if you had a 20 or more day assignment, but it didn't distract or detract from our expectation that you show up. If you're not, we are tracking attendance. So we are marking students absent who aren't there, certainly taking attendance for those that are. So I don't think that's totally addressing the comment, but I also may need some clarity on the optional piece.
Sure, I'll work on that while you're giving the other update, because I do know that that was a change, that there was a change in the code of conduct. We do have families that, where students are being removed from their building, but they're not going to the Promise Center. And so, I've actually brought it up a couple different ways, and so I will find, more succinctly what I'm speaking about, but let's
Okay.
keep going.
Okay.
And I do, before I allow you to keep going, do we have board member Mapp?
Yes, can you hear me?
Okay, so
Okay,
board
perfect.
member Mapp, welcome.
Yes, thank you for having me. I was glad that I was able
We
to
can't hear
join.
you, but. Oh,
You can't hear me?
We can hear you now. We can hear you.
Okay, perfect. So I was saying thank you for allowing me to attend. I'm excited to be here, although it's virtually, but I do have a few questions for Dr. Little. And you may have already answered this, but I was having some technical difficulties. So as it pertains to the slide, it was one of the earlier slides discussing the categories for infractions. So you spoke about there's a decline amongst Black and Brown students for category 2, but there is an uptick that we noticed within category 1. Are you able to verify or explain what's causing that uptick?
I don't think I can answer the question on root cause, board member Mapp. Again, category 1 offenses are things that are typically in the classroom. So disruptive behavior, sort of not listening or following through on expectations of the teacher. And those are most often, and they should be dealt with in the classroom. As to what's driving students to do that, I'm not sure I can answer that.
Okay. Do we have any targeted interventions to ensure that those don't continue to trend upward and possibly kind of spiral over into category 2 or 3 offenses?
Absolutely. So the thing that should really address most, if not all, of category 1 offenses is the work that the school does around PBIS. So we continue to engage and provide support to schools to make sure they have a really strong PBIS plan and PBIS implementation. Because that's sort of as we think on the academic side of tier 1, 2, and 3 supports, we can also think about that on the behavior side. And PBIS really establishes the tier 1 foundation for the school. So what are the expectations in the classroom, in the hallway, throughout the campus? How are we reinforcing that? How are we recognizing and rewarding it when people are doing well? So that's really the main avenue that we can think about those lowest level offenses and working to make sure that we got the systems in place to tamp those down and respond to those in the best way possible.
Okay, perfect. Thank you for that. And then I have another question. Again, it may have already been discussed, but as it pertains to the cohort restorative practices, I'm curious to know how were the schools identified from a tiered response of intervention or based off of greatest needs or infractions? How were those schools selected to be in cohort 1, 2, or 3?
Yeah, what you just said was the thing that we looked at. So we wanted to make sure that we got all of our high schools in early, because certainly the prevalence of more severe offenses like category 2 and 3 generally skew themselves to older students. So all of our Title I high schools are in cohort 1. And then we looked at the data and consulted with our school leadership team around the elementary schools that we could fit into cohort 1, really looking at those schools that typically had higher incidences of discipline.
Okay. All right. Thank you. That's all that I have for now.
Thank you so much. All right, did you have any more questions for this?
I do not.
Let's move on.
All right, we'll go to mental health. there's sort of two pieces to this mental health update. One is something that we're doing specifically in our schools. And then the second is just a bit of awareness for the committee on what's happening more regionally around mental health, which we are involved in and are excited about. So the first, what's happening in the schools, I shared with the committee earlier in the, actually late last spring, that new legislation required all school districts to start to provide programming for 6th to 12th graders around the three topics we see on the slide: social inclusion, safety training and violence, and suicide awareness and prevention. So that law laid out an expectation for us to roll out programming to students in those grade levels in these three areas. We have set about, on the next slide, doing that in partnership with our schools in a deliberate sort of focus of moving from social inclusion up to what we're now focused on, which is suicide prevention, putting that more difficult topic a little bit later in the process to work to build a foundation of trust between students and the staff that are doing this, and sort of set up a parameter to be able to have those conversations. All of the materials that we're using have been vetted by, I was about to get their name wrong, the Ohio Department of Education and Workforce. They are provided for free to us and to districts right now, and they're really based on the Sandy Hook work. So there's a curriculum that came out of Sandy Hook that is really the underlying basis of this. Our social work team did a lot of vetting of that and other resources to make sure that we were comfortable. And this is as turnkey as possible. So we give all the resources to the schools. They work to identify a champion for this within their building. And then at the school level, they're really making the decision on who's leading the programming. Is that the social worker or the counselor, or the teacher sort of volunteer and say, hey, I want to do this as well. So that's sort of being facilitated at the building level. The next slide shows where we are right now in terms of participation. Obviously, most of the focus has been on getting social inclusion done as we're moving through the year. We're continuing to focus on the other two areas. But the other thing to call out here is families do get to opt out. So you don't have to participate if you feel like this is something that you don't want to have your child participate in. So there is an opt-out process. There's a letter that they get. And you see that those opt-out rates are really pretty low, though. So happy that most people are engaging. So happy to provide an update later on in the year to the committee on where we actually end with numbers here, but wanted to share where we had started thus far around these three topics. The next piece here around mental health is really, again, zooming out at a much bigger level across the region, not just within Cincinnati Public Schools, but I wanted to share with you a little bit of where that was. So some data to set the foundation here. When we look just in the tri-state area, we see a couple of alarming things. The first is, as you look at rates of depression, death by suicide, or to our earlier conversation about alcohol use, you see that those are really high prevalences within the Ohio, Kentucky, sort of Indiana area, with Kentucky and Ohio really popping off the charts in some of those places. The other thing that we see from national data here is most parents would say that their child is doing okay from a mental health perspective, but a third of youth say they're actually not. So there's a bit of disconnect there between what adults may be aware of and what youth are actually experiencing. That led to, on the next slide, a group of funders across the region to come together to say, okay, we need to better understand what this looks like more locally to us, and then start to create a long-term plan for how to address it. So those funders, which are footnoted on the previous slide, really spent about 6 months looking at the data from a grassroots and a grass tops perspective. So doing interviews, conducting focus groups, looking at national data sets, trying to understand the landscape that we're seeing in the broader Cincinnati region. Next slide sort of tells us that we're now in a place taking that data, which really took about the last 6 months to gather, to start to develop the plan on what we do next. So again, I would reiterate that this goes beyond just CPS. It's a broader regional effort. We are very much engaged in part of this and excited to see where it goes, because we do know, as we've talked at this committee, that there are barriers to entry in terms of getting mental health services. We know that based on this data and what we're hearing, that more youth likely need support, some families as well. So this plan will help to have a region-wide strategy for what that looks like really over the next decade. So last slide on this topic gives a sense of what folks are going to start to dig into. There are now 3 groups that have been established: community and caregivers, schools, and a treatment group. So they're kicking off their work actually this month to start to dive deeper in building out the strategy for what could actually come to bear in terms of mental health provisions in the area. All right.
I don't have any questions around this topic. I do know that do you have any questions, Vice President Weinberg?
I do not.
I do know that go ahead. Board Matt, do you have any questions?
I just have 2 questions. So we do recognize that the death by suicide rate is quite alarming, especially in Ohio. Dr. Little, do you know if at any point we will be able to identify data points around how this directly correlates to CPS students?
I will tell you that we are certainly trying to do that, Board Member Mapp. So there are really robust conversations happening between us, between Mindpeace, between Children's Hospital and the broader group that's working on this regional effort to try to understand more acutely early indicators of that. So as we're seeing students exhibit certain behaviors or need to show up at Children's to receive certain type of treatment, how does that then create a response? We're not there yet, but people are working to get to where you just asked about.
Mm-hmm. Okay, perfect. And the other question about the larger or broader scope of the work that's being done regionally, and you may have already shared this, but specifically, what is CPS's involvement in this like steering process? Because it sounds like it's very much at the developmental stage. So I am looking forward to seeing the implementation as that time, occurs or evolves over time. But what would you say is our role specifically in connection with this implementation or program structure?
Yeah, I would say 2 things. We are certainly a partner in the work. So we are participating in these meetings. We will have representation for sure on the schools work group, but we're obviously a big recipient of it as well. Like, we are the largest district and have the most number of students in the region, as we all know. So the strategy, while it's beyond CPS, is also centering what it looks like in CPS as we build this out, because it will impact more of our students than anyone else.
Yeah. And do we have student input with this committee or with this focus group? Have we identified students from our district that's taken the initiative to really provide feedback or direction on supports that would be beneficial?
There are. So in the assessment phase, what happened in the last 6 months, there were 7 focus groups that were done that included about 60 youth, and some of those youth were CPS students. The only other thing I want to go back and mention to your question about death by suicide and thinking about that, as those conversations are ongoing, we're also obviously having to keep in mind privacy concerns.
Absolutely.
Both from a HIPAA and FERPA perspective, but also back to that disconnect between what youth are saying they're experiencing versus what adults in their lives may be aware of. So we're trying to navigate those issues as well.
Okay. Thank you, Dr. Little. I appreciate the detailed information.
Thank you.
Thank you. I do know that there was some question from the city around the mental health and what we were doing to address some of our mental health concerns from our students. I also want to ask, are we doing anything around mental health of our staff? Because our staff, students kind of they receive a lot of what our staff are feeling as well. Have we done any assessment around staff mental health? Like a cultural audit, but I'm really specifically looking for mental health of the staff.
Yeah, Board Member Moffitt, I don't think we've done an assessment of staff mental health specifically. We certainly get indications of staff well-being through the Panorama survey, which is much lower level sort of indicator, but we have that data that we've shared and that we continue to look at. The other thing, obviously, through our Human Resources Department, there are employee resources available for people who need to reach out for a variety of things, including mental health. The other thing I would say is if a staff member is exhibiting extremely concerning behavior, while at school, we can help provide very in-the-moment support just to keep that person and those around them safe, but we do not provide therapy to our staff.
Sure, sure. I wasn't really thinking of that. I was just kind of trying to, asking more high level to gauge, and not just at the school. I'm talking about really the district as a whole. Do we do any assessment around the mental health of our staff in general? So that was really what the question was about.
Yeah, no, and back to the privacy concern, that would be something that we would have to really struggle with because it's obviously up to the person to divulge whatever health issues they may be experiencing, whether that's physical or mental health. So there's certainly no database of that.
Sure. And I was just thinking like, just a check-in. Hey, 2 questions. How are you doing today? Are you doing okay? Not necessarily divulging specifics, but just do we do that
Yeah.
gauge for students and staff? Thank you. Thank you for this detailed report. Last, I think.
Yep, last piece here, there were SROs and resource coordinators on the agenda. I will tell you, I got 2 slides here for SROs. We don't have slides for resource coordinators, but I'll explain that in just a second. Really basic high-level information here to sort of ground us in the SRO discussion. The first is just a reminder on how they're assigned. So CPD makes the assignments of the SROs, and it's important to us, just like when we think about transportation, also for SROs, that goes beyond just CPS schools. So SROs are supporting non-public and charter schools as well. So the numbers in parentheses here are the total numbers, for example, that SRO Brown supports, 13 schools. Aiken is the primary high school, but that 13 includes some non-public and charters as well. So going beyond our set of footprint here in CPS. It's also important then to remember that their time mostly is spent on the high school campuses. Our elementary schools certainly work to build really great relationships with their SROs, but they're not going to be as physically present at an elementary school as often as they would be at a high school, as they're prioritizing where they are given the number of schools that they support. The next slide is just a reminder on sort of what our agreed upon focus is with SROs. This comes from the MOU that we have with CPD and the city. That MOU is expiring this year. We have some renewal options built in there, but that's a conversation that we're kicking off with CPD and with the city. The 2 things to really keep in mind here, SROs should not be involved, and they're not, in school discipline. So that's still left up to the school administration. Only when that school discipline potentially crosses over into criminal activity does the SRO get involved. So that could be a weapon, it could be drugs, it could be alcohol theft. There's a number of things contemplated there, but they're not deciding whether a student gets a category 1, 2, or 3 consequence, because they're not part of that piece of discipline. The other thing is they are real supporters to our safety and lockdown drills. I know that's a topic on an upcoming agenda, but they participate in those drills. They provide feedback to the schools as needed to update their safety plans, and they're critical partners in that work. That's it that we had for SROs. The explanation of why we don't have data in here for resource coordinators, because we're currently collecting it. So we're in that part of year where the lead agencies do their mid-year self-evaluation and the schools do their mid-year self-evaluation. And so that data is coming in. So we'll be able to share that at an upcoming update. But we're currently in the process of pulling that together.
Great. Any questions that you have, Vice President Weinberg?
No, thank you.
Board Member Mapp, do you have any questions?
I don't have any questions about SROs, but I wanted to go back to your point, Dr. Moffitt, about the mental health of the teachers and the staff. And so, Dr. Little, I wanted to know if, as a district, we have an employee assistance program or EAP program where teachers are informed about maybe counseling resources that they are able to receive for free. I don't know if that's something that we have, but I'm just curious to know.
We do have an employee assistance program, and every staff member is encouraged to attend what we call CPS 101. So in their first month of being on the job, they come for a full day orientation to all things CPS. And that's one of the things that we go over. I can't answer specifically whether it's free or not. It likely goes through insurance, but I'm not certain.
Yeah. it definitely is, connected to the insurance, but those sessions typically are offered maybe 6 to 8 sessions for free as a part of their benefits package. And so I was just curious to know in the event how much we are advocating for those services to be utilized or made known to our employees.
Um,
So I'm assuming that it's just available, but you don't have data around.
I certainly don't have
usage.
data today on usage. I'm not sure if that data is available. We can check to see if it is.
Well,
Okay.
it would be great. So,
Yeah.
I do want to also say that while we don't have information or data around resource coordinators, we are spending a significant amount of time talking about resource coordinators. So I was kind of hopeful that we would have some data available so that we could see effectiveness, what schools have them, what schools do not have them. That data should have certainly been available from the past. So that's unfortunate that we don't have that, so that we can at least look at buildings that have them, what programs are being offered by lead agencies, what lead agencies are available, where there are gaps in resource coordination to kind of weigh in on effectiveness. But perhaps we can definitely put that on the agenda for the next meeting for sure. Board Member Mapp, did you have any other questions around anything else that we've talked about today?
I do not.
Vice President Weinberg?
I do not, thank you.
So one of the things that we needed to discuss a little bit further is, I think I've heard from the committee members, Vice President Mapp, and then Vice President Weinberg and Board Member Mapp around the cadence of our meetings. That actually is a decision that should be decided by the committee. And we talked about keeping them for every other month at the moment. And I shared with Board Member Mapp yesterday, as an appointment from the board, I am assigned to the Hamilton County Addiction Response Coalition Steering Committee. And I'm happy to sit there. We are also being invited as Cincinnati Public Schools, and we're on the prevention side. And a very big part of what we're going to be asked for is data around substance abuse for students, prevention, any type of strategies that we're looking at as a district, and some data around what we've seen. And as I shared with Board Member Mapp, if we don't have the opportunity due to timing to get it discussed in the committee, perhaps I'll just bring it to the full board and we can just discuss it there if we're in need of data that is not aligning with the health and safety. And then we can just review it at the health and safety meeting. So I don't want to stop progression. The county has definitely included us in conversations that are very significant along with the city. And I just don't want us to be precluding that. So we'll keep our cadence, and there may be some additional topics that come up for the Health and Safety Committee future meetings. If you do have those as committee members, let me know, and then we'll get that information out to Dr. Little so he can present it to us timely. Dr. Little, did you have anything else to add? Did you need any clarification for anything?
It would be helpful if the expectation moving forward is to provide materials to the committee in advance of them being posted, to get clear on what that timeline is and what the timeline of getting any feedback in return from the committee would look like. To your point about cadence, our position hasn't changed there in terms of desired frequency, but making sure that we're not missing each other on when you're expecting to receive materials and then when we can in turn expect to get any feedback.
Sure. Vice President Weinberg, would you like to go? I have my thoughts. We've definitely shared this. Did you want to talk about history? Did you want to talk about anything?
No, I'm going to let you go ahead as the chair for health and safety. Just really quick to add in, I know beforehand when I was the chair, the information was sent, and if there were any issues, which there weren't, so that's a good thing. Obviously, it would be sent back and asked for some updates and any questions, but I think up to the chair, it's regarding kind of how you would like that to go forward.
So as I shared in my email, my expectation is that committee members review all material prior to it being posted for the public so that we can make certain that the topics are addressed to the questions that we have and that we may be getting from the community. And then we will, so presentations, I would assume the week of the week before the meeting or however far ahead you are able to get the presentation to the committee, we will have about a 48-hour turnaround time for any feedback to you before it is posted to the public. It should not be the expectation that, hey, this is what it is, and then that's been posted. It should be that this is what the committee wants to see answered. And if there's any clarification that's needed, any additional information that's needed, I'm assuming it would not be time consuming for you to do it. I wouldn't give you anything that would have you doing an hour or 2 hours worth of additional work. It would just be to maybe clarify something or put something in. But I think if we're succinct in our instructions and directive from the committee during the meetings for the next meeting, then there shouldn't be anything additional except for, as in this case, can you clarify, take off percentages and put in the numbers? But prior to anything being public, it needs to go before the committee as a whole, and then we'll kind of give the okay, like, hey, this is good.
That's helpful because that is certainly a new process for me as being the staff liaison to the committee. You may have just clarified one other question I had, Dr. Moffitt, which is, getting specific on what we want to discuss on the topics. We talked about this last month, like some of these are really broad and need some narrowing for each meeting. That in the past year happened really from Chair Weinberg at the time, sort of sending around specific questions that we were trying to address. You sent some questions in advance this time. So getting that clarity early enough to create the materials, I think is as important as just making sure that they get to you before they go live and we can have a round of feedback.
Absolutely. I think that definitely sounds fair. What we will do is, since we are going to stick with the cadence of every other month, what we will do is look at the next topics after this meeting and then circulate to the committee members clarity around what they'd like to see, and then forward that to you so that you have clear direction on what the expectation is. And then from there, we will be able to see your presentation and what you are offering as an explanation for those topics, and then offer you any additional suggestions or anything else, and then give the okay as a committee that it be published publicly.
That's helpful.
So we will definitely do due diligence, but the expectation, it's been my experience that the board drives the questions and then clarifies if there is any clarification needed. Board Member Mapp, did you have any other topics that you'd like to see for next month? Did you have any other clarifying comments?
So not around topics, but I do want to make sure that we are clarifying the process, I guess, for feedback a little bit more. I think we should set a timeline or a specific amount of time to make sure that we give that feedback and then close that off at a certain point so that Dr. Little and his team will be able to generate the presentation so that it can be online and available to the public as well.
Sure. 48 hours notice has always been the practice of the board. Ms. Phyllis, definitely correct me if I'm wrong. So we need to publish our presentations to the public 48 hours before the meeting date. There's been some concern around what that 48 hours means, but it's been my understanding close of business on Thursday is typically around about 48 hours. So if in this instance, the presentation was provided, let's say Monday, we would have 2 days to get any closing remarks, clarifications to you, which would be Wednesday morning. You could get any changes that need to be made and sent back. So I just stick with the 48 hours. Again, if you send a presentation a week or 2 weeks prior to, we can certainly get them reviewed and looked at, but 48 hours notice from the time that you send any presentation to the committee, I think is a very fair expectation for committee members to turn around their questions. If you all feel like you need more time at Board Member Mapp, Vice President Weinberg, let's iron that out now. But when Dr. Little sends us a presentation, is 48 hours enough time for you all to review the presentation and send back any clarifying questions?
It would be fine for me. I don't have a problem with that.
Board Member Mapp?
Yes. Yes, same here.
Okay. And then anything after that, and I was slow myself in responding, but anything after that is kind of like, hey, we're gonna just go with that. And but again, it still kind of needs that okay with from the committee prior to being posted. And who posts those, Ms. Phyllis? Is that our board staff that posts the presentations for the committee? Okay. So since our board team is not in charge of that, prior to posting, we want to give that okay, that, hey, this is cool. We have some questions. Just let the committee or I as the chair can make sure that we give that directive that it's okay for posting. Yes, ma'am.
I just have a quick question since we're talking about topics, and Ms. Phyllis, if you could clarify this for me, and also as the chair, did we get an opportunity to agree to our work plan for the committee for the year?
I think we collectively worked on it. It is pending.
So I would just want to put out a little reminder to really make sure that we finalize that, because I heard you ask a question of if there were any additional topics, but at that time, that would be that work plan, so that we would want to stick to that work plan. And if there is anything new, that would just go into other business.
Well, the only thing that we're going to add is the information from the Addiction Response Coalition. And that's
And
the
that's
only
great.
reason why I made it pending, because I wanted to, that meeting was last week and I wanted to see what type of data they would need on a regular basis before I committed to finalizing the work plan. So we did meet
Perfect.
last week, and I do have a slight sense of data that they need. And I'll put that to Ms. Phyllis and we can send that out.
And no problem. I just wanted to make sure that I didn't miss anything. So we will probably do that for the next meeting. So sounds great.
Yes, ma'am. Board Member Mapp, do you have anything else for the good of the committee?
The final question, it was to Dr. Little's point. So in terms of how we are finalizing our plan in terms of reports and presentations, so is this at the discretion of each, I guess, committee in terms of how we want to receive information and finalize that information, or is this standard across the committees in terms of processes?
What's your question? I'm sorry. I'm sorry, Kendra, what is you said your question was to Dr. Little. I want to be sure. What are you asking?
No, I said it was to Dr. Little's point about
Oh, okay.
how we are finalizing presentations and reports. I was asking, is it at the discretion of each committee on how we finalize that information to present for each committee meeting? Or it's kind of a standard process across all the committees? Meaning the administration provides the information to the committee, and then we get feedback, and then the administration goes back and finalize that feedback. Just trying to get an idea about processes.
So it has been my experience that it is at the discretion of the chair. Some chairs are very succinct in how they ask for their information, so there's no need for clarification. But every committee is made up of board members that have a chair, and that chair decides how they want their committee to receive that information. So I think it could look different by different chairs. Some people don't need a lot of presentations, some people do. But again, that is based on at the discretion of the chair and how they're running that particular meeting. This is my preference to have information prior to being posted so that we're all in alignment on clarification if needed and the data that is being presented to the public. So that's my preference, that we see that as a committee prior to anything being public.
Okay. Okay. Thank you for that clarification.
You're welcome. All right. Do we have anyone that that's desiring to speak from hearing of the public? All right. Well, then I think we've done really good having a meeting in exactly an hour. We will have our next health and safety meeting. Ms. Phyllis, when is it? April 29th? April 29th at 4 p.m. And hopefully you'll be able to join us at that time. Thank you so much. Enjoy this beautiful day. Part of health and safety is getting some sun rays and some good vibes. So hope that you get that. Have a great one. Bye-bye.